Hi dear students! Today is our first lecture of diagnostic radiology and radiotherapy. The subject of our today's lecture is diagnostic radiology, imaging techniques. Every day, millions of people undergo imaging evaluations to assess a wide range of medical conditions. When the power of imaging technology is appropriately expanded, these studies yield a wealth of useful medical information. Knowledge of the different imaging modalities and their relative costs and benefits is vital to proper management of patients. Radiology is the medical discipline that uses medical imaging to diagnose and treat disease. A variety of imaging techniques such as radiography, ultrasound, computer tomography, nuclear medicine, including positron emission tomography, and magnetic resonance imaging are used to diagnose or treat disease. Interventional radiology is the performance of usually minimally invasive medical procedures with the guidance of imaging technologies. In this picture, you can see different types of diagnostic imaging. First picture is plain radiography of chest. After that, you can see computer tomography of abdomen and three-dimensional reconstructed computer tomography. Also, you can see in this picture magnetic resonance tomography, medical ultrasonography, and nuclear medicine PET scan methods. The modern practice of radiology involves several different healthcare professions working as a team. The radiologist is a medical doctor who has completed the appropriate postgraduate training and interprets medical images, communicates these findings to other physicians by means of a report of verbally, and use imaging to perform minimally invasive medical procedures. Okay. With help different diagnostic imaging, we can diagnose the cause of this signs, monitor how well patient is responding to a treatment, and screen for different illnesses. In radiology, we can use from different types of rays. All rays which are used in medicine, we divide into main parts: ionizing rays and non-ionizing rays. It is clear that during interaction ionizing rays with human body, they can make free ions because these methods are harmful for patient's body. But non-ionizing rays can't make this effect and they has not harmful effect for our body. There are many types of medical imaging modalities, and they are different from each other. Computer tomography, fluoroscopy, radiography, and nuclear medicine images. In these methods, we use from ionizing radiation, as you can see here. Ionizing radiation is a type of radiation that has enough energy to potentially cause damage to DNA and may elevate a person's lifetime risk of developing cancer. The risk of developing cancer from medical imaging radiation exposure is generally very small and depends on radiation dose, patient's age, patient's sex, and body region. Okay. But other types of diagnostic imaging, such as medical ultrasonography, magnetic resonance tomography, and medical thermography, has no harmful effect for our body. that we define non-ionizing radiation as any kind of electromagnetic radiation that does not carry enough energy to ionize atoms or molecules, not removing any electrons, but rather making them vibrate, thus raising the body's temperature. And in contrast, ionizing radiation, which does have the energy to remove electrons from the atoms and molecules of the bodies it strikes. That these methods they have non-harmful effect for our body. It's so important because before of application, before of investigation of patient, we can choose correct types of this method, especially during investigation pregnancy women and in childhood. Okay. In this picture, you can see natural radiation, those from natural background radiation. But notice what is natural radiation. Natural radiation comprises cosmic radiation and the radiation arising from the decay of naturally occurring radionuclides. The natural radionuclides include the primordial radioactive elements in the Earth's crust, the radioactive decay products, and radionuclides produced by cosmic radiation interactions. Primordial radionuclides have half-lives comparable with the age of the Earth. Cosmogenic radionuclides are produced continuously by bombardment of stable nuclides by cosmic rays, primarily in the atmosphere. Humans are exposed to natural radiation from external sources, which include radionuclides in the Earth and cosmic radiation, and by internal radiation from radionuclides incorporated into the body. The main routes of radionuclide intake are ingestion of food and water and inhalation. The worldwide average natural dose to humans is about 2.4 millisievert per year. Remember, the worldwide average natural dose of radiation is equal about 2.5 millisievert. Okay, if we compare radiation dose during different diagnostic investigation, such as X-ray and computer tomography, with natural background radiation, for example, a chest X-ray, for example, delivers dose is 0.5 millisievert, as you can see here. But in computer tomography, in chest computer tomography, radiation dose is equal to 7 millisievert. That's 17 times as much. Because we can provide diagnostic imaging, especially the imaging in which we use ionizing radiation, just after strong indications towards to these methods. The history of radiology started with Wilhelm Röntgen in 1895. Wilhelm was able to take the first X-ray, which was of his wife, and won the Nobel Prize in Physics in 1901 due to his new discovery. He had experimented with passing electric currents through a tube, and by going so was able to figure out how to turn this experiment into an X-ray. After working 4 weeks in his laboratory experimenting on the production of strange rays, which he referred to as X-rays, he asked his wife Anna Bertha to lend a hand, the left one to be prized, which he used to produce the first X-ray image. This is known as hand mitringen. She exclaimed in fear, "I have seen my death," after seeing the image. In this picture, you can see X-ray tube. X-ray tube is source of X-radiation. It's X-rays for medical diagnostic procedures or for which purpose are produced by in standard way by accelerating electrons with a high voltage and allowing them to collide with a metal target. X-rays are produced when the electrons are suddenly decelerated upon collision with the metal target. These X-rays are commonly called Bremsstrahlung or braking radiation. If the bombarding electrons have sufficient energy, they can knock an electron out of an inner shell of the target metal atoms. Then electrons from higher states drop down to fill the vacancy, emitting X-ray photons with precise energies determined by the electron energy levels. These X-rays are called characteristic X-rays. Okay. In this picture, you can see different types of X-ray films. X-rays are observed to a variable extent as they pass through the body. The visibility of both normal structures and disease depends on this differential absorption. X-rays are observed to a variable extent as they pass through the body. The visibility of both normal structures and disease depends on this differential absorption. With conventional radiography, there are 5 basic densities: gas, fat, all other soft tissues, and all calcified structures and metals. In this picture, you can see it: air, fat, soft tissue, minerals, bones, and metals, as you can see here. X-rays that pass through air are least absorbed and therefore cause the most blackening on the radiograph. For example, on chest radiography, you can see lung parenchyma as dark areas. But calcium and all high-density structures absorbs the most, and so the bones and other calcified structures appear white, as you can see here. Bones and high-density structures appears on X-ray film as white points. The soft tissues, with the exception of fat, muscle, blood, a variety of fluids, bowel wall, they all have similar absorptive capacity and appear the same shade of gray on conventional radiographs. Fat absorbs slightly fewer X-rays and therefore appears a little blacker than the other soft tissues. Images can be produced using a silver-based photographic emulsion, or they can be recorded digitally and viewed on computer screens. Okay, in this picture you can see different X-ray images, different types of X-ray imaging. For example, on chest X-ray you can see mass in right parahilar region and multiple small nodules of left lung. There's metastasis, lung cancer and metastasis, or this mammography, that's X-ray investigation of breast, mammary gland, and you can see typical image of malignant tumor and benign tumor. Okay, in this picture, you can see production of X-ray. As you know, source of X-radiation is X-ray tube in all X-ray images. X-ray tube covered with lead materials atomic weight of lead is high. Lead absorbs X-rays. Inside of X-ray tube is placed cathode and anode. And during production X-ray, the electrons separated from cathode and they reach to anode at high speed, and 2% of releasing energy changes to X-rays. Okay. And produced X-rays directed to investigated area, and depending on structure and density of investigated area, we can see image as dark and white points. As you can see here in this produced X-ray image, bones appears as white points because they are high density structure, but soft tissue appears as dark points. Okay. Sometimes during X-ray examinations and on computer tomography, we use from contrast agents. Radiographic contrast agents are used to visualize structure or disease processes that would otherwise be invisible or difficult to see. Barium is widely used to outline the gastrointestinal tract. All the other radio-opaque media rely on iodine in solution to absorb X-rays. Iodine-containing solutions are used for urography, angiography, and other intravenous contrast administrations. Usually, they are given in large dose, often with rapid rates of ingestion. As their only purpose is to produce opacification, ideally they should be pharmacologically inert. This has not yet been locally achieved through the current low osmolarity agents, such as the non-ionic media, have exceedingly low complication rates. In this picture, you can see plain radiograph of chest without contrasting, but after barium swallow, you can see lumen of esophagus, or plain abdomen radiography, and radiography after contrasting barium enema. After barium enema, you can see lumen of large bowel. In this picture, you can see barium swallow. Barium swallow is most important method for investigation, esophagus, stomach, and for alimentary tract disease. After contrasting, we can see lumen of them. Next method is medical ultrasonography. This method is so important for investigation of soft tissue disease, parenchymatous organs during pregnancy, and blood circulation. And medical ultrasonography is used from medical ultrasound, and in diagnostic range they can't make biological changes in our body because this method has no harmful effect for patient's body. In diagnostic ultrasound examinations, very high frequency sound is directed into the body from a transducer placed in contact with the skin. In order to make good acoustic contact, the skin is smeared with a jelly-like substance. As the sound travels through the body, it is reflected by the tissue interfaces to produce echoes, which are picked up by the same transducer and converted into an electrical signal. As air, bone, and other heavily calcified materials absorb nearly all the ultrasound beam, Ultrasound plays little part in the diagnosis of lung or bone disease. The information from abdominal examinations may be significantly impaired by gas in the bowel that interfaces with the transmission of sound. In this picture, you can see ultrasound imaging during pregnancy. You can see abdomen ultrasonography, pancreas tumor. Also, one type of ultrasound of application of this method is Doppler mode or Dopplerography. What is it? Sound reflected from a mobile structure shows a variation in frequency which corresponds to the speed of movement of the structure. This shift in frequency, which can be converted to an audible signal, is the principle underlying the Doppler probe used for investigation of blood circulation, blood vessels disease. The Doppler effect can also be exploited to image blood flowing through the heart. Here, the sound is reflected from the blood cells flowing in the vessels. If blood is flowing towards the transducer, the received signal is of higher frequency than the transmitted frequency, whilst the opposite pertains if blood is flowing away from the transducer. The difference in frequency between the sound transmitted and received is known as the Doppler frequency shift. The direction of blood flow can readily be determined, and flow towards the transducer is by convention colored red, whereas blue indicates flow away from the transducer. With help Doppler mode, we can investigate different diseases of blood circulation. For example, Doppler studies are used to detect venous thrombosis, arterial stenosis, and occlusion, particularly in the carotid arteries. In the abdomen, Doppler techniques can determine whether a structure is a blood vessel and can help in assessing tumor blood flow. In obstetrics, Doppler ultrasound is used particularly to determine fetal blood flow through the umbilical artery. With Doppler echocardiography, it is possible to demonstrate regurgitation through incompetent valves, and pressure gradients across valves can be calculated. In this picture, you can see stenosis of internal carotid artery. Next method is computer tomography. The origin of the word tomography is from the Greek word tomos, meaning slice, and graph, meaning drawing. Although also based on the variable absorption of X-rays by different tissues, computer tomography imaging, also known as CAT scanning, provides a different form of imaging known as cross-sectional imaging. Computer tomography was developed by Sir Godfrey Hounsfield. It is a diagnostic imaging method that uses X-radiation associated with a computer system that reconstructs circumferential data equation into axial image slices. A CT imaging system produces cross-sectional image or slices anatomy like the slices a loaf of bread, as you can see here. In different planes, we can see image of investigated area. The cross-sectional images are used for a variety of diagnostic and therapeutic purposes. Okay, in this picture you can see principle of computer tomography. A motorized table moves the patient through a circular opening in the CAT scan. As the patient passes through the computer tomography imaging system, a source of X-rays rotates around the inside of the circular opening. A single rotation takes about 1 second. The X-ray source produces a narrow, fan-shaped beam of X-rays used to irradiate a section of the patient's body. The thickness of the fan beam may be as small as 1 millimeter or as large as 10 millimeters. In typical examinations, there are several phases, each made up of 10 to 15 rotations of the X-ray tube around the patient in coordination with the table moving through the circular opening. The patient may receive an injection of a contrast material for visualization of vascular structure. Detectors on the exit side of the patient record the X-ray exciting the section of the patient's body being irradiated as an X-ray snapshot at one position of the source of X-rays. Many different snapshots or angles are collected during one complete rotation. The data are sent to a computer to reconstruct all of the individual snapshots into a cross-sectional image of the internal organs and tissues for each complete rotation of the source of X-rays. Computer tomography is used in different areas of radiology. Benefits of computer tomography include more effective medical management by determining when surgeries are necessary, reducing the need for exploratory surgeries, improving cancer diagnosis and treatment, reducing the length of hospitalizations, guiding treatment of common conditions such as injury, cardiac disease, and stroke, improving patient placement into appropriate areas of care such as intensive care units. Thus, on computer tomography, we can receive images in different planes, axial, sagittal, and coronal planes, and we can see pathologic area, localization, size, borders, and status of surrounding normal tissue. And these all parameters are so important in order to make accurate diagnosis. With help on computer tomography, with specific software, we can reconstruct image as three-dimensional image. This method is so important, especially for diagnosis of traumatic lesions. The human eye can only appreciate a limited number of shades of gray. With a wide window, all structures are visible, but fine details of density difference can't be appreciated. With a narrow window width, variations of just a few Hounsfield units can be seen, but much of the image is either totally black or totally white, and in these areas no useful information is provided. For example, in this picture you can see axial layer of lung window and soft tissue window. A lung window is used to view lung parenchyma, as you can see here. Lung parenchyma, which Hounsfield's unit is equal to minus 500 unit, would be within range, appearing gray. Air pockets around the lung, such as pneumothorax, for example, or bulla, would appear black, thus allowing clear differentiate them. But on soft tissue window, is used to view most organs. A soft tissue window can't be used for lung parenchyma. That's in this window we can't see lung parenchyma, as lung density is outside range and will appear completely black. A bone window is used to view bone detail. There is good differentiation within the range of high densities found in the bony cortex and medulla. That is, with help a specific window, we can see detailed image of investigated area. Okay. In this picture, you can see X-ray film and computer tomography of COVID pneumonia, and so important diagnostic criteria of COVID pneumonia on X-ray, on radiography, are airspace opacities, usually, or consolidations. Usually, we can find it bilateral and in peripheral localization and lower zone predominantly. You can see bilateral, so pleural consolidations. But on computer tomography, important diagnostic criteria are ground glass opacities, usually bilateral, subpleural, and in peripheral areas of lung, crazy paving appearance, and inter and intralabular septal thickening, airspace consolidation, as you can see here, bronchovascular thickening in the lesion, and sometimes traction bronchoectasis. Magnetic resonance tomography. Okay. Magnetic resonance imaging is a type of scan that uses strong magnetic fields and radio waves to produce detailed images of the inside of the body. This method can be used to examine almost any part of the body, including the brain and spinal cord, bones and joints, breasts, heart and blood vessels, internal organs such as the liver, womb, or prostate gland. The results of MRI scan can be used to help diagnose conditions, plan treatments, and assess how effective previous treatment has been. MRI is particularly useful for the scanning and detection of abnormalities in soft tissue structures in the body, like the cartilage tissues, and soft organs like the brain or the heart. There is no involvement of any kind of radiations in the MRI, so it is so safe for the people who can be vulnerable to the effects of radiations, such as pregnant women or babies. MRI scan can provide information about the blood circulation throughout the body and blood vessels, and also enabling the detection of problems related to the blood circulation. Okay. But what is principle of MRI? Most of the human body is made up of water molecules, which consist of hydrogen and oxygen atoms. At the center of each hydrogen atom is an even smaller particle called a proton. Protons are like cinemagnets and very sensitive to magnetic fields. When patients lie under the powerful scanner magnets, the protons in patient's body line up in the same direction, in the same way that a magnet can pull the needle of a compass. Short bursts of radio waves are sent to certain areas of the body, knocking the protons out of alignment. When the radio waves are turned off, the protons realign. This sends out radio signals which are picked up by receivers. These signals provide information about the exact location of the protons in the body. They also help to distinguish between the various types of tissue in the body, because the protons in different types of tissue realign at different speeds and produce distinct signals. In the same way that millions of pixels on a computer screen can create complex pictures, the signals from the millions of protons in the body are combined to create a detailed image of the inside of the body. Okay, in this picture you can see principle of production of magnetic resonance tomography. Okay, as you know, the basic principles of magnetic resonance imaging and depend on the fact that nuclei of certain elements align with the magnetic force when placed in a strong magnetic field, as you can see here. At the field strengths currently used in medical imaging, hydrogen nuclei in water molecules and lipids are responsible for producing anatomical images. If a radio frequency pulse at the resonant frequency of hydrogen is applied, a proportion of the protons change alignment, flipping through a preset angle and rotate in phase with one another. Following this radio frequency pulse, the protons return to their original position. As the protons relax, they induce a radio signal, which, although very weak, can be detected and localized by antenna coils placed around the patient. An image representing the distribution of the hydrogen protons can be built up. This principle of production of magnetic resonance tomography. You can see the protons relax, they induce a radio signal, and without this signal we can see image of the organ as distribution of the hydrogen protons of investigated area. MRI scan is done in enclosed space, so the people who have claustrophobia, that's fearful of being in a closely enclosed surface, are facing problems with MRI to be done. It is one of the disadvantages of this method. Next disadvantage is MRI scans involve really loud noises while processing because they involve a really high amount of electric current supply. And patients with pacemakers and certain ferromagnetic applications can be studied with magnetic resonance tomography, and these methods, the scanners, are usually expensive. It's one of the disadvantages of magnetic resonance tomography. The strength of the signal, MRI signal, depends on not only on proton density, but also on two relaxation times, T1 and T2. T1 depends on the time the protons take to return to the axis of the magnetic field, and T2 depends on the time the protons take to the phase. T1 weight image is one in which the contrast between tissues is due mainly to their T1 relaxation properties, while T2 weighted image, the contrast is due to the T2 relaxation properties. Some sequences produce images which approximate mainly to proton density. Most pathological processes show increased T1 and T2 relaxation times, and therefore these processes appear lower in signal, that's blacker, on T1 weighted scan, and higher in signal intensity on a T2 weighted scan than the normal surrounding tissue. Okay, in this picture you can see open MRI. What is it? What is it? People who are claustrophobic may fare better with open MRI machines. It is also more comfortable for very overweight or obese patients. The high field open MRI offers more space and more airflow for greater comfort. Open MRI machines have wider openings and are less confining. They allow technicians to communicate and maintain eye contact with the patient on the table for a more empathic and calm experience. Faster scanning speed reduces the imaging corruptions caused by the patient's motion. Because they have to remain stationary for shorter periods, images are clearer and usually more acceptable on the first try. Okay. MRI is used for diagnosis of different clinical applications. For example, in clinical neurology, segmentation and classification, measuring volumes of brain structures, multiple sclerosis, neurodegeneracy, stroke, and other. In cardiology, and for investigation of tumors, malignant tumors, breast cancer, colorectal cancer, and soft tissue damage, cartilage, ligaments, and other. MRI is also used a great deal in basic science to study brain function and cancer growth. In this picture, you can see MR angiography. You can see brain vasculature. MR angiography is rapidly gaining in importance. It can be fused with the complementary computer tomographic angiography. Magnetic resonance tomography also is used for diagnosis of heart disease. For example, for myocardial infarction. MRI is so important method for investigation of cancer, especially breast cancer and colorectal cancer. And for investigation, brain and spinal cord disease. Nuclear imaging. Nuclear medicine imaging use small amounts of radioactive materials called radiotracers that are typically injected into the bloodstream, inhaled, or swallowed. The radiotracer travels through the area being examined and gives off energy in the form of gamma rays, which are detected by a special camera and computer to create images of the inside of our body. Nuclear medicine imaging provides unique information that often can't be obtained using other imaging procedures and offers the potential to identify disease in its earliest studies. In medicine, nuclear methods applied in three forms: scintigraphy, or two-dimensional images, PET, positron emission tomography, and SPECT, single photon emission tomography. Okay. Scintigraphy, also known as a gamma scan, is a diagnostic test in nuclear medicine where radioisotopes attached to drugs that travel to a specific organ or tissue are taken internally, and emitted gamma radiation is captured by external detectors to form two-dimensional images in a similar processes to the capture of images. The nuclear medicine whole body bone scan is generally used in evaluations of various bone-related pathology, such as for bone pain, stress fracture, non-malignant bone lesions, bone infections, or the spread of cancer to the bone. Bone scintigraphy, in this picture as you can see, of the patient, showing an increased uptake in the right proximal humerus, as you can see here, red arrows, as well as the apex of the skull also. There is also an increased uptake of the thyroid gland. In medicine are used from different radiopharmaceutical drugs. For example, ammonium is used for diagnosis of myocardial perfusion. Chromium is used to label red blood cells in diagnosis or of anemia. Dysprosium is used for diagnosis of arthritis. Fluorine is used for cerebral, myocardial, and tumor glucose metabolism. Holmium is used for diagnosis of liver tumors. Iodine and compounds are used to evaluate filtration rate of kidneys, to diagnose deep vein thrombosis, to diagnosis of thyroid and kidney function also. Gallium is used for tumor imaging and localization of inflammatory lesions. Okay. In this picture, you can see nuclear medicine myocardial perfusion scan with thallium for the rest image. The nuclear medicine myocardial perfusion scan plays a pivotal role in the non-invasive evaluation of coronary artery disease, and the study not only identifies patients with coronary artery disease, it also provides overall prognostic information or overall risk of adverse cardiac events for the patient. In this picture, you can see nuclear parathyroid scan, and nuclear medicine of parathyroid scan demonstrates a parathyroid adenoma adjacent to the left inferior pole of the thyroid gland. The above the study was performed with technetium, sesamebe, and iodine, simultaneously imaging and subtraction technique. Okay. SPECT, or single photon emission computer tomography, is a three-dimensional tomographic technique that uses gamma camera data from many projections and can be reconstructed in different planes. Positron emission tomography uses coincidence detection to image functional processes. In this picture, you can see SPECT liver scan with technetium labeled autologous red blood cells. A focus of high uptake in the liver is consistent with a hemangioma. Iodine 123 whole body scan for thyroid cancer evaluation. The study above was performed after the total thyroidectomy and stimulation with thyroid hormone medication with Dravet. The study shows a small residual thyroid tissue in the neck and mediastinum lesion consistent with the thyroid cancer metastatic disease. The observable uptakes in the stomach and bladder are normal physiologic findings. In some centers, the nuclear medicine scans can be superimposed using software or hybrid cameras on images from modalities such as CT and MRI to highlight the part of the body in which the radiopharmaceutical is concentrated. The practice is often referred to as image fusion or co-registration, for example, SPECT computer tomography and PET computer tomography. The fusion imaging technique in nuclear medicine provides information about the anatomy and function which would otherwise be unavailable or would require a more invasive procedure or surgery. For example, in this picture you can see normal whole body PET scan. The whole body PET scan is commonly used in the detection, staging and follow-up of various cancers. That's for investigation of primary and secondary tumors. This method is so important. Okay, what is advantages of nuclear medicine imaging? Main advantages are functional imaging. This method is functional, sensitive, very safe, low radiation, screening and follow-up, whole body evaluation without increased radiation dose to the patient, and very high specificity. As you know, in this method we use from radiopharmaceutical drugs, and the disadvantages of this method are radiation risk, and images are not usually disease specific, usually requiring an injection into the bloodstream, disposal of radioactivity waste, and relatively high costs. Interventional radiology is a medical specialization that involves performing a range of imaging procedures to obtain images of the inside of the body. The interventional radiologist carefully interprets this image to diagnose injury and disease and to perform a range of interventional medical procedures. Interventional radiologists use imaging techniques such as X-rays, magnetic resonance imaging, fluoroscopy, computer tomography, and ultrasound. Well-recognized advantages of these minimally invasive techniques include reduced risks, short hospital stays, lower costs, greater comfort, quicker convalescence, and return to work. The effectiveness of treatment is often better than with traditional treatments. In this picture, you can see different modes of interventional radiology. As you can see here, they are cancer ablation, gastrointestinal stenting, airway stenting, and aortic vascular disease, and other. One example, for example, steps in a TIPS procedure. And first picture, you can see portal hypertension has caused the coronary vein and the umbilical vein to dilate and flow in reverse, as you can see here. This leads to varices in the esophagus and stomach, which can bleed. In picture B, you can see needle has been introduced and is passing from the hepatic vein into the portal vein. And in picture C, you can see the tract is dilated with spatial balloon dilatation. And finally, after placement of a stent, portal pressure is normalized and the coronary and umbilical veins no longer fill. As an example, in this picture, you can see distal embolization of distal arterial bleeding using a microcatheter for splenic trauma, angiogram before and after coiling. And finally, medical thermography. Thermology is the medical science that derives diagnostic indications from the thermal patterns of the human body. Thermography is the process of medical infrared imaging or the mapping of the thermal patterns of the human body. Thermogram is a head picture. This is the image that is captured by an infrared thermal imaging camera. Medical thermography is the mapping of the head patterns of the human body using high resolution thermal sensitive infrared thermal image cameras and the interpretation of those thermal patterns. Because of its ability to detect the head associated with inflammation, thermography is now being used for early detection of developing physiological conditions. How is thermography different? First, thermography sees the head associated with inflammation and is therefore able to capture a real-time physiology or functional of the body. Second, other imaging modalities such as X-ray, CAT scan, ultrasound see structure, its morphologic changes, but not function. And finally, thermography can detect changes in physiology before they become symptomatic and manifest structurally. Thermography is used to detect cardiovascular diseases such circulatory problems, thyroid disorders, digestive disorders, for example, food allergies, lymphatic disease, endocrine and immune system disorders, and breast disease. Okay, for example, in this picture you can see a normal and heart attack waiting to happen. Thermograms, this detecting early signs of heart attack. Application fields of thermography. In this picture you can see different thermal images or thermograms. These images they showing cardiovascular temperature anomalies. Thermography is so important method for diagnosis of circulatory problems. For example, in this picture you can see phlebitis in left leg and for diagnosis of circulation in extremities before and after the treatment. Thermography also is used for diagnose thyroid gland disease, temporomandibular joint disorders, for example, inflammation, tooth and gum pathology, usually inflammatory processes of them and abscess, and thermography is used for diagnosis of diabetic foot. One of important applications field of thermographic method is breast disease. Advantages to using thermography for breast disease are thermography can be used by small-breasted women and large-breasted women, women with breast implants, women with dense breast tissue, women with fibrocystic breast tissue, women who are pregnant and or breastfeeding, women who are premenopausal in menopause or postmenopausal period, and women who are on hormone replacement therapy, And thermography can be used to monitor hormonal balance and imbalance. Important benefits of this method are this no radiation method, non-invasive and non-contact for patient's body method, fast, easy, effective, inexpensive method, and for diagnosis of some disease, for early detection of some processes, this method is so important. Okay, thermography is a diagnostic screening that is safe and effective, fast and easy. It's a proactive measure in identifying systemic inflammation. Thermography would confirm the need for further testing and evaluation by physician. And if systemic inflammation is identified, patient and physician can discuss preventive measures that can be taken to reduce inflammation and risk of disease. It is all. Today I told you about the general concept of radiation diagnostic methods, their principles and areas of application. In all cases, you should know that each examination method has its advantages and disadvantages. When choosing a method of examination, it is necessary to take into account how dangerous it is for humans. For example, is this method ionizing or invasive method, cost method, or complexity? All radiation diagnostic methods are a branch of modern medicine that is closely related to all areas of medicine. Every radiologist should know that a correct diagnosis is the basis of treatment. My dear students, if you have any questions about what was said in the lecture, you can contact me at the email address shown on the slide. Thank you for your attention.